Hello.
Okay. Hello, everybody. Thank you very much for joining our support webinar office hours. This is the second webinar in this series. This will be essentially a duplication of the first one. So if you did attend our initial one back in December, a lot of these the slides and the questions and the answers will all be relatively similar. I just wanted to say that up front in case you felt that you needed to attend both. It will be the same information. Okay. So with that said, another just um, piece of information we want to provide in the beginning of this. We understand that there was a lot of information that came out last night and early this morning pertaining to different grants from SAMHSA. This webinar is going to be simply discussing the support A and C. I know that people may have questions about the different emails and notices that your organization might have received for other grants. At this time, this is not the forum to talk about that. We do not have the responses, any official response from SAMHSA pertaining to any notices will be sent out via official correspondence through ERA and other metrics. We don't have any more information or responses other than what has already been presented. Okay, so we apologize for that. Kate, if you want to go to the next screen. Um, So to start off with this, if you haven't attended a Teams webinar before, I know that a lot of the times we do things over Zoom. I do want to start off by saying where can you post your questions? If you look at the top bar of your Teams chat, you should have a Q&A section next to the chat. That Q&A option is where you can create your post and um, ask any of your questions. Throughout this webinar, you can ask a question whenever you want. Hopefully, we will be answering those through the actual information in the slides, but still ask a question. We will respond to it as quickly as we can. If you notice we're not answering your question, you don't need to post it again. What it means is most likely we are going to respond to it. We know that it's coming up in one of those next slides, and Kate is going to be talking about it. So don't worry if you're sitting there saying, why hasn't my question been responded to in 10 minutes, something like that. When we respond to a question, we will also archive them. You should be able to click the little drop-down menu and filter it by archived. So if you're wondering where your question went, it's not because we deleted it, we answered it and we archived it. You can, and anyone else can see those archived questions. So please do that. Um, Okay, so that's how you can post questions. At the very end of this webinar, we are also going to open it up for more questions. We're going to be responding to a lot of the most pertinent questions. If we see a lot of the same questions being asked, even if we responded to it in the chat, we are also going to read it out and try to explain it verbally and orally so you guys can hear all of those. Now, the point of this support training is really to provide additional information pertaining to the sport. Anything at all, we're going to go over it step by step, everything that you're going to have to do with it. We're also going to highlight specifically CCBHC considerations. I do understand that there might be other projects that you might be collecting support information. The support tool is across SAMHSA. It is a SAMHSA-wide initiative that is supposed to consolidate a lot of this information so there are not multiple different types of data collection for SAMHSA that you're doing. This is one of the things that we're going to be doing this. So please understand that this information pertains only to the CCBHC program. Okay, so the things we're talking about here may not pertain to other projects that you have, even if it is still using the support tool. Okay, Kate, if you could we go to the next slide. Okay. Now, the other key aspect of this, why are we switching to the support tool? A lot of this is to reduce burden. We understand from the field and a lot of this information that this has placed an undue burden collecting information. So hopefully this will help reduce that. There are two versions of the support. There's a support A and a support C. We're going to go over that in depth. But very quickly, the support A is an administrative version and the C is the client side. We are shifting some of the burden from the client and your frontline staff over to the administrative part of it, which means a lot of that information should be already in your systems and you can provide that without having to add extra time and burden to your staff and clients. So they're not answering the same questions about their demographics, for example, every single time they are provided this tool. Okay. So hopefully that helps you guys. With that, I'm going to pass it over to you, Kate. And then remember, everyone, please, if you have questions, ask them away in the chat and we'll be responding. And then we'll open it up for questions after Kate has completed the entire slide deck. Thank you.
Great. Thanks, Hillel, and welcome to everyone. This will be, as Hillel mentioned, it will be duplicative of the session that was offered last month. So if you came on and you missed that little bit, know that I am going to try to repeat myself of what I said in December. So if you already attended the previous training on Support AC, feel free to drop off now because we're going to try to repeat as much as possible.
I forgot to put it on my calendar and I just seen it in my
I think
pop-up
everyone
saying, "Hey,
needs
it's
to
coming."
mute.
I was like, It's the same as the training that was earlier, but
Okay, thank you. So talking a little bit more about the SAMHSA Unified Performance Reporting Tool, we abbreviate this as SUPPORT, or we say it quickly as SUPPORT. And in particular today, we're going to be talking about the two parts of the client level data, the client level data support C and the client level data support A. And the support C is a survey that's collected from our clients or our caregivers, depending on the age and capacity of the person filling in the form. And we have our client level support A, which is the administrative record, which is completed by someone with the grantee and is collecting information that you might have gotten from interviews, or you might have gotten from demographic forms or online forms, or it might be in your record from your providers, but that's the administrative report. We're not talking about today, and it doesn't currently impact the CCBHC grants, but you might have seen, because it's open for public comment, is the Support P. The Support P is also a cross SAMHSA tool. It is project level measures, and the Support P is replacing our IPPs. And then you also know, because we just had that submission, or you're working on last minute submission of your programmatic progress report. So this is our whole suite of data management. But today we're talking about the client, caregiver, and administrative report for Support A. Going into more detail, as I mentioned, SUPPORT stands for that SAMHSA Unified Performance Reporting Tool. Primarily, this is unifying data collection that was happening at both CMHS, the mental health services, and at CSAT, the substance abuse treatment center that we had. And as I just said, the project level Support P is coming soon. These kind of separate components, if you've opened up the documentation that has been available for these tools, you may have opened them all up separately, or you may have received a combined PDF that had all of these tools in. But basically, for the client or caregiver survey, we've designed it really so that it can be printed right out or handed right out to the client or caregiver, so it's self-contained. It doesn't have a lot of skip logic or questions that you might move around from. And that's why it actually shows as a whole set of tools. And then we have our administrative report, where it's just the one tool. Not all sections are completed at all stages. We'll talk about that a little bit. But we're figuring, because you're grantees, you're setting this up in an administrative system yourself as you go through the process. So it sits as the one tool by itself. So this administrative report replaces questions that used to be completed by the grantee, even when an interview was not completed. So if you remember on the NOMS, sometimes we talked about, yes, but at least get in your administrative record. So that administrative record was split out from what the clients and the caregivers do. And this was largely seen as a way of simplifying it and making it easier, so that you didn't have to kind of go back and forth or skip a lot of questions if you were only trying to do the A. So just like the administrative report under NOMS, this is completed even if the client or caregiver refuses. It's completed even if you can't reach the client or caregiver to do their survey. And for those clients that actually had a NOMS baseline, it's completed even for clients who started their initial baseline, or maybe even their reassessment was initially under NOMS. you still have to do a support A for all of those clients. So you may have to amend your internal data capturing systems. Those may be systems that you've built into things like RedCap or Qualtrics, or it might be built within your electronic health record so that you can align to the fields that we're now looking to collect. The support A and C are collected just like NOMS was at the different assessment points. So a support A is collected at baseline, reassessment, annually, and closeout. It's collected for all of your clients that you have sampled in because your CCBHCs, you're working on a sampling plan. So for every client that was chosen to be part of the data collection sample, a support A is due at each assessment period for while that client is in an active episode of care. So it doesn't matter what their age is or whether they were surveyed, it's completed at each assessment point. CCBHC is staying with a 6-month reassessment, the same as we had under the NOMS assessments. And the annual assessment is newly added with support A, and that annual assessment is done on the 12-month anniversary of the client's baseline and enrollment. For support C, the part that's filled in by the client or the caregiver, we don't do a support C assessment at closeout, and we don't have a support C annual assessment for children or for youth. We only have it for adults. For the support AC data collection requirements, we have all completed assessments must be entered into SPARS within 30 days. And the support A data needs to be entered into SPARS before a support C data can be entered. The client ID is used, it's the same client ID is used for both support A's and support C's. It's used for baseline, for reassessment, everything. The same client ID is used across all of these different assessments. And therefore, it has to start with that support A. That's where you establish that a client actually is enrolled and receiving services. Just like we had under the NOMS protocols, reassessment and annual assessment is not required as soon as that client has a closeout, as soon as they're discharged from the grant services. Once that closeout is entered, no future assessments are due. So if you had a client who enrolled on October 1st, 2025, and then they were due for their 6-month assessment in April, March, whatever that 6-month hits right there. But before they were due before they would have had their 6-month reassessment, maybe they were closed out and discharged from care in December. Once that's entered in, no further assessments are due. Just like before, though, if that client comes back and starts a new episode of care, then we would do a new baseline, and 6 months after the new baseline, if they're still continuing in that episode of care, there would be the reassessment, and a year after that, there would be the annual assessment. So a lot of these elements should be really familiar to you if you were aware of NOMS. We have tried to keep that kind of timing similar across both tools. The support C, the client or caregiver form, that's really a survey of the client or the caregiver. It replaces the interview questions that we used to ask of those clients or caregivers. The questions that are asked and how they're asked are different depending on our age group. So we have different forms for adults, for youth who can respond on their own, which are considered those youth who are 12 to 17 years old. For children or youth who are not able to respond on their own because of the age or for other reasons, those would be children or youth who are 5 to 17 years old. And for very young children, those children who are 0 to 4. If you have a client, and this comes up, and I'll repeat it a couple of times as we go through, if you have a client who's 14 years old, for example, it is the choice of that caregiver, of that client, of the provider, of your own processes, whether you fill in the youth form or the children or youth form that's done by the caregiver. You don't have to do both. We don't want a response from both a caregiver and a youth. So once they're in that 12 to 17 age group, there's a choice that can be made, and there's lots of different reasons why that choice might be to have the youth respond or why it might be for the caregiver to respond. That's open. It's a decision that is made much more right at that time point. But only one of those two forms has to be done. Another aspect of this is once you start in one form, so let's say that it was a 17-year-old who started services at 17, but maybe they started services at 17 and 11 months, but they filled in the youth form. When they come back 6 months for a reassessment, at that point they're 18, but they should stay on the youth form. So once they've started one of these forms, a 0 to 4 or a youth, then they stay in that form until that series of surveys is finished for them, because the questions differ, and we want to keep the baseline and the reassessment or any annual assessments all on those same series of questions. So reiterating a few of these big changes that I've mentioned, but just to emphasize them here from the NOMS in terms of our process or policies for collecting data, the support clearly separates that administrative record, which is completed by the grantee, from the client or caregiver survey, which is completed by the client or caregiver. This really should help in terms of no longer having to skip around, having these separated. You can have a different process for how and who implements both of these different tools. We have also removed the requirement for interviews. This should be the biggest change in terms of burden on the clients, and should also help you in terms of being able to implement this. The default method for surveying the clients or the caregivers is a self-completed survey. So we've tried to really make these questions much more simple, short. That's why we removed the skip logic. We have the consent built right in there in the form. We expect that maybe it'll be paper. You could set it up on a tablet or a computer. They can do it in the waiting area before they come in. They could do it if you send them a QR code because you've built it online. You could have them do it even before they come in for services. So this should be a real reduction in the burden on clients. They don't have to do it right at that, right maybe when they're feeling stressed. You could perhaps have them do it just after the visit. Hey, please complete this before you, by the end of the day or something like that. I say we've removed the requirement for interviews. We will address in our frequently asked questions, but just to also emphasize here, if an interview is still appropriate, maybe the person is not English or Spanish speaking, and so we don't have a printed tool for them. Maybe their literacy or otherwise their capacity to fill in a paper form or a computer form is something that you need to assist with in this particular time, there can still be an interview. We also have had questions about whether it could be done over the phone in an interview format. So long as there is a way to maintain the confidentiality of the responses and get this done, it can be an interview. It's just that you don't have to do an interview, which is what we had as the NOMS. Hillel mentioned, and you've seen again, that we've also shifted questions from that client caregiver survey to the administrative record to reduce the number of times that a client or caregiver are asked the same thing. I think some examples of this in particular are things such as whether they have been, whether they were recently hospitalized, or whether they were recently incarcerated. Those things have moved to the medical record. Many of our programs already were asking these questions as part of a behavioral health history. They were already screening for suicide risk, or they were screening for trauma, and those were built right in. They were screening for whether there'd been this kind of hospital visit or emergency room visit. And also, some of you had programs and relationships and referrals. So if you receive a referral from a hospital, we didn't want you to have to ask the client, hey, have you been in a hospital? You know that the only reason that that client is in front of you right now is because you have the referral from the hospital. And so this would allow you, where you do have that information already in the medical record from behavioral health history taking, from referrals, that you're able to report that rather than asking the client again. Another big change, and this one is an increase in burden rather than a decrease in burden like the first ones I mentioned, is this adding the annual assessment again. For those of you who had a SAMHSA grant, a CMHS grant before 2022, you know that we used to do reassessments every 6 months. So we didn't bring back the every 6-month reassessment, but we have brought back in for our adults only, a survey and then an administrative reassessment for everyone at that 12-month anniversary. So if somebody is in care for all 4 years of a grant, we would expect to have, the baseline, a 6-month reassessment, an annual reassessment at the end of year 1, an annual reassessment at the end of year 2, an annual reassessment at the end of year 3, etc. So there could be multiple reassessments for that same client. Primarily, these reassessments really help us to understand that person is receiving continued services, and having those extra information every year that that person is continuing to receive services helps to support the funding for these grants, because we can show that the reason these clients are still in care is because they're still actively receiving services supported in particular by our grants. Showing some of these main points in a little bit more detail. This interview not required, this self-completed survey. I'm already aware of multiple grantees who have tried to program this into their EHRs or have brought this into REDCap, brought this into Qualtrics. It should allow you to set this up as this online. And in addition to it being a self-completed survey, we're hoping if you've looked through the questions that you can see that many of these questions are now also aligned with standard questions. So it's not just the demographics, such as the race and ethnicity questions, being aligned to the new OMB standards, but our social drivers of health, and we have questions about disability. All of those are aligned to questions that you probably already were asking if you have grants from HRSA, if you're receiving Medicaid funds. So this should help you to hopefully align your systems and increase familiarity and really streamline this data collection. We did test these tools. We both did cognitive testing with clients and also practice and really looked at it. And so the overall time, particularly for our reassessments, there's very few questions left for reassessments. And hopefully then these surveys can be, completed quite quickly in a waiting room in a few minutes once you have your paper or your systems up and running and can hand out to them. And again, with this note down here on the bottom of the emphasis, to clarify there, it's a choice of either the youth or the caregiver when they're in that age group where they could fill it out for themselves, but for whatever reason, maybe the caregiver is still filling it in. These questions on the shifting to the administrative report, I show a few of them here, like have you been homeless or spent time in mental health care or spent time in substance abuse disorder, and that these have moved into that admin report, and you can check your records if you got that referral, if even during another part of the behavioral health history you had that information. It doesn't have to be in an interview. That being said, if you don't yet have these as part of your behavioral health history taking, then these would be questions that we would be looking for our grantees to build into those processes and the systems, because we felt it was important to check on these. I think also some of them are more up to date than they had been before. For example, we now explicitly ask about crisis services, whether somebody has has needed 988 or has called 911 or otherwise got that crisis emergency care. These services have really expanded significantly in the last few years, particularly through CCBHCs, and we're now able to capture that information that we weren't before. You can also see from the questions just listed here that for those questions about incarceration in correctional facilities and pretrial supervision, that we have put in a skip logic that didn't exist before, that we're only asking these questions for clients that are 11 years or older. We don't collect information about whether or not a 6-year-old was arrested, whereas before that was a little bit confusing because there wasn't an inherent skip logic built into those questions. A few more key changes from the NOMs. These focused a little bit more on the content than the policies or the procedures. We have now aligned to those HHS standards for different definitions and wording that we use. And we have also updated it to reflect at the time that we got this approved, executive orders for demographics and the social determinants of health. We have removed multiple NOMs for anyone on the call who has who's working on a CCBHC grant that is from the older cohort, from an FY 2022 cohort that was under evaluation. This is one of the main reasons why we didn't actually switch that cohort under evaluation off of the NOMs because the support does not capture social connectedness or functioning or the psychological distress or the perception of care. We have added in new client-reported SAMHSA core outcomes of recovery. I'll show that in a minute. We have also reincorporated questions to cover substance use and substance use treatment. I think there were a lot of CCBHC grantees in particular who missed those when they were removed in 2022 from our NOMs. So those are now back in because we've got this unified tool. And we've also expanded our service arrays to include substance use, crisis, and integrated services. So again, that's the highlights. Now I'm going to go into a few of those in more details and also talk about like these policies for implementation that we have across the board. We've expanded our windows for data collection. The window initially for collecting a baseline, particularly for a CSAT grantee, used to be 7 days. It's now been expanded to 30 days. And even for baseline, there's actually a 30-day window on both sides. So in total, it's 60 days, 30 days before, 30 days after. That's for our baseline, it's for our reassessment, it's for our annual assessment, and for our closeout. So all of our assessments have this expanded window for data collection, and then all of that data should be added into SPARS 30 days after it's collected. CCBHC grantees in particular, emphasizing this, you will continue using your approved sampling plan while you're implementing SUPRT AC. So you're implementing the SUPRT AC just like you would have implemented a NOMS. You're not implementing it on all 3,000 clients. If you were approved for a 5% sampling rate, if you were approved for a 10% sampling rate, only on those clients that have been sampled in, then you would do the data collection using SUPRT AC. We also have received a lot of questions about incentives. And in many cases, the policy on the incentives is very similar to that from NOMS, where you may offer incentives for the 6-month reassessment and the annual assessments for SUPRT C. The NOMS only included a 6-month reassessment. So it may be that there's now going to be more assessments where you would like to offer incentives. And so that may be a discussion. You have to look at what that incentive level will need to be. You'll have to make sure that you can get it into your budget, and you'd need to have discussions on any budget changes if you're wanting them with your GPO and your grants management officer, just like any other kind of budget change or policy change that you would have. So that's something to consider. However, also hopefully this is a much lower burden on the clients, to move from the interview to a self-completed survey. So maybe even though there's more assessments to be done, maybe it is easier to do it or for a lower level of incentive. We also do want to highlight again here that previous NOMS clients. So if the baseline was done in NOMS, if the baseline was due before October 1st, 2025, when we switched over to Support AC, then you do not have to do a Support C for those clients throughout that entire episode of care. So their reassessment or their annual assessments, you do not have to do Support C. You only have to start doing Support C for clients who enrolled after the transition to Support AC. So that should maybe, again, affect the number of incentives that you might want to offer, because even though there's more assessments, that annual assessment for anybody who started back in our fiscal year 25, they don't have to do a Support C. We have a few frequently asked questions here. We'll go through them, and this might address some of the questions that you're already putting into the Q&A box, or that you might have had at the end. So we'll go through these, but we'll still have some time at the end to go through any new ones that come up. So one of the very first questions we've got is, do we have to create new Support AC records for all of our clients? No. Your clients, if you had a baseline established in NOMS, or even if you had a baseline, a reassessment, and a closeout, those clients, you should already be able to see them over under Support AC. So all those NOMS records should have moved over for what aligns in terms of the administrative kind of information, should have moved over within SPARS. If you do not see, if you have gone in there and you have been trying to find, and you had a client where you had a baseline NOMS and you're trying to enter Support AC and you don't see that, don't create a new record, contact the SPARS help desk. So this should have already happened and should have been seamless. If it wasn't, let the SPARS help desk know as soon as possible. Next question, do we have to use the Support C for clients who were interviewed using CMHS NOMS or the CSET GPRA? No. If they started under NOMS, you only have to do the admin record. You don't have to do the Support C. You only have to do the Support A. We had clients who enrolled after we stopped using the NOMS or the GPRA, but we were only allowed to start the Support AC as of 10/1. What do we do with those? You could go ahead and collect the Support AC on it. As I mentioned, even on the baseline, there's that 60-day window. So even if the client enrolled September 5th of 2025, you chose not to do a NOMS, you can go ahead and enter in that Support A for them and backdate it to September 5th. So it's valid. We've got a window. Go ahead and use the Support A tool as soon as you're ready for it. We don't routinely screen for some of the listed behavioral health screenings as frequently as we're required to complete the Support AC. Do you have to change your screening practice? No. So we implemented these guidelines in terms of asking the questions about or guidance in terms of asking the questions about the screening and the periods of the 6-month and the year. We implemented that across all of our programs with a unified tool. If you didn't do the screening, you just say, we didn't do the screening. We're not trying to change your practice through the actual data collection. We're just trying to find out if you did do the screening, what was the results? If you didn't do the screening, tell us that you didn't do the screening. So this isn't about doing just because we ask whether you did a suicide screen doesn't mean that you should have done a suicide screen. That is still like whatever the good practice is, whatever clinical guidelines are for the different screenings that are listed. As always, we have the clients receiving services under multiple SAMHSA grants. Do we have to do separate assessments for each grant? This answer is brand new for Support AC. It's one of the key reasons why we changed to Support AC by having a unified tool with these expanded window of the 30 days before and 30 days after for our data collection. You should be able to collect the data once and use it for multiple grants. Let's say a client was receiving services under the CCBHC, and maybe they were also receiving services under a Healthy Transitions, or they were also receiving services under a CSET grant. Hopefully now we've got it to the point of you really can collect it once and report it under the different grants if that was the case. So we do encourage you to use the same client ID for that individual across any SAMHSA grants that you are reporting on. If it is the same client, use the same client ID, and that will help you keep track of as well the fact that they are being reported under multiple grants. So we also have gotten the question about, we haven't yet changed our intake forms to collect the race ethnicity in the new categories. So we have introduced the new categories for the race and ethnicity, where race and ethnicity is a combined question. And there's also more minimum categories. And one of the biggest changes is that Middle East and North African descent has been added as a choice. If you haven't adopted these and the client didn't complete the Support C at baseline, so they declined the Support C at baseline and you weren't able to get it directly from the client, you would report under Support A that you don't have the information in that category. Please do not map data from a different set of questions on race and ethnicity to the new one, because how would you map it? It's a completely different set of questions. If we didn't ask the person before whether they were Middle East or North African, how would you know whether they were reporting that they were white or that they're Middle East, North African, for example? So we ask that you do not map or try to align responses. If you're using the new questions, you can report the responses to the new questions. If you're not using the new questions, then you should report that you haven't captured the information in those categories. We get the question, if an individual requests to discharge the services before their 6 month or the annual reassessment date, do we complete a discharge Support A, or do we complete the reassessment and the discharge? If they discharge, if they close out, you complete the discharge or the closeout record, which is only a Support A record, and then no other records are required. So if they discharge right at 6 months, feel free to just complete the discharge, and that's it. That's the only thing that you need to do. Does the client-facing portion of the support tool need to be completed in person, or can be conducted over the phone? As I mentioned, it's designed to be self-completed, so it can be completed over the phone, it can be completed over the computer. You can send an email or a QR code with a link. We ask that you don't send like an email with just the responses right in the email, because that's not confidential, that's not protected. But if you send in an email the request to fill in the forms, and then it links to something that has the protected system, that would work. So you just need to make sure that however you're collecting it, whether it's phone or video call or QR code or in person or on paper, however you're collecting it, you just make sure that you're protecting any PII and protected health information as you're going through that. I keep saying it because we get lots of questions, so I'm being repetitive, but we feel it helps. Only one Support C needs to be completed if it's a youth 12 to 17. So if the youth 12 to 17 completes the form, their parent or caregiver does not. If their parent or caregiver completes it, the youth does not. And once you do one of those forms, so If a youth completes it, it doesn't matter. If they turn 18, the next time around, they should be given the youth form again. And we don't require 2 reassessments, the 3 and 6 month. CCBHCs only do the 6-month assessment. There's no 3-month assessment required for the CCBHC program. Last few questions that we have listed here. Is the annual version only at the 1-year mark or every year consecutively that patient is active? It is every year consecutively that patient is active. Every year, so long as they're active. If the client-facing portion is not completed within the window, should the record management section of Support C still be entered in SPARS? Yes. So there is a record management section of both the Support A and the Support C. The record management section, when we have it on the Support C, it's like down at the bottom, it's the last thing, and it's like, internal office use only, where we need a client ID. We need to know the date that the assessment was offered, and if it was either completed, in which case we'd get all the rest of the questions answered, or it was not completed. So that's the same as we used to do before. We just want to know, because that way SPARS won't keep bugging you and saying, hey, there's a Support C due. You could just go in and say, yep, we offered the Support C, the client declined, and that's it. You would move out. How will reassessment interview rates be calculated with the transition and the implementation? Well, importantly, there's no longer a required interview, so there won't be a reassessment interview rate. There will be targets. We will be looking at the data as it comes in. We will be assessing to look at the completion rate. And we'll be looking at whether and working to assist you and maybe offering, like, changing policies on incentives or offering guidance on how to make this even easier for clients to complete it if we have low completion rates. So we will be working on targets and improving our completion rate, but reassessment interview rates will no longer exist. If the data collection window for Support C has closed, do I still need to offer Support C? No, you don't. We prefer not. It's 6 months, so we've already given a 60-day window around that. And so let's say the baseline was done late and then the Support C was done early, then we're no longer looking at a baseline and a 6-month. We're now looking at a 3-month and a 5-month or something. It doesn't help us. And so if you do complete it outside of the window, you can enter that data in SPARS, but we won't use it for our analysis. We won't use it for our reports to Congress. We won't use it for evaluation. So you really don't have to collect that data if you've missed the window. Just record that the window closed. You weren't able to capture that from the client, and we'll address it on the other side. If the data collection window for Support A has closed, the administrative record, if that data collection window has closed, do I still need to do it? Yes. Please do Support A as soon as possible. This is your administrative record. If you don't tell us at least that the client existed with the baseline or what services that they received, then we can't show that you're, actually implementing the program and doing the work. So Support A, fill in at least the minimum fields that you have available to you and get that into SPARS as soon as you're able to. Will the reports built into SPARS be changed to reflect support? Yes. They don't currently reflect support. So if you try to go into SPARS and you go under client served or demographics, or you go into the data downloads, you're not accessing the information from Support C. That's old information. It's out of date. Those don't currently reflect Support C, but they will be updated. Will there be batch upload? Yes. Current date that we heard from SPARS this week is that batch upload should be available at the end of January. So I think it's January 28th is the date that they're expecting to launch it. So look at the end of January. Of course, then, if you depend on batch upload, you may be sitting with a increasing stack of records that you can't enter. You can communicate that to your GPO. If they ask, why haven't I seen any support A or C records entered? You could say, we're waiting for the batch upload. That lets us know that you're in that situation. And then as soon as that functionality opens up in SPARS, we'll expect to see you trying to do that. If you have difficulties, once batch upload opens, contact the SPARS help desk immediately. Will there be data download for support AC? Yes, that functionality is also coming. So we're expecting batch upload at the end of January. We're expecting data download by the end of February, and then reports will be further into the spring. Those were the questions and the information that we wanted to get through here. I think we have other ones popping into the Q&A that we may want to read out and open this up. So hello.
Thank you very much, Kate. So just as a reminder, if you do have questions, please post them. I know that some people are posting them in the main chat. We'll try to answer from both, but please try to log them in the question and answer also. It makes it so they're all in the kind of the same spot. The first question that we've been receiving a lot is about this recording as a whole. Yes, this is recorded. We will be posting it. What will happen is once we get everything approved through, we have our own approval process here at SAMHSA. We will be sending out a link. It will be a YouTube link to our SAMHSA YouTube channel. We'll send that out and you guys will have access to all this information through there. Okay, so if you need to go back and review anything that Kate just went through, that'll be there. We'll also be able to send out these slides so you can look through these slides too. Okay. One of the questions that we've gotten, Kate, is about the consenting of for this. So what happens if a client declines throughout this process? What happens if they answer no, they don't want to consent to this information being provided?
Yeah, so we have built a consent form directly into the support C, so that one that goes out to the client caregiver and again, because we tried to design that support C that you could hand it right out or build it in really easy. So there's a very simplified consent about how long it's going to take and what will happen. And then if they don't consent on the support C, that's part of the record management section, the internal office use only, that you would then enter in SPARS and say they decline to provide consent for the support C. For the support A, that needs to be built into your participant protection and your normal processes, so that you would communicate to the clients that as maybe you collected this information in another way, and you'd let them know that we also, because of grant funding requirements, share this information with SAMHSA, and they could decline to provide that. There is minimal, there are fields within the support A. Many of the fields have an explicit answer that the client declined to have that, declined to provide that information for sharing. And so you can see that right there in the form. Or if because they declined it, you didn't collect it, you can choose that as the option too, that you don't have that information in your records. So the support A is not trying to be an end round around client consent. It is just trying to reduce the burden. You are asking these questions oftentimes in these other forms, that behavioral health history or a different kind of client intake that you did, and it's already in your system. So you still have to build in that consent. That's your responsibility to work through your own internal processes and make sure they're aware of the fact of what you're sharing and what you're not sharing with SAMHSA through those forms.
Okay, thank you. And then returning to that, the question about people that were previously nommed versus now that we're switching to support. So my understanding is if they're previously nommed and they had a baseline under noms, they would continue, but they would only be needing to do the support A and not the C. Is that correct?
Yes, that's correct. So if they had a baseline in noms, only the administrative record is due for the rest of the time out.
So that would be
The
for
rest of the
both.
episode of care.
So that would be their 6-month reassessment and those subsequent annuals, correct?
That's correct.
Okay.
Subsequent annuals.
And then what about if their 6-month or their annual date fell in that in between time, right? So we stopped the noms in August. What happens if this happened in like September before we really rolled out that support tool?
So for example, a client, let's say a client started care in September of 2024. And so their annual assessment maybe had been due in September of 2025. It was therefore not due. The first annual assessment that would be due for that client in support A only would be in September of 2026. So if the due date for a reassessment or an annual was before October 1st in support A, it is not due. So even if the window of period was still open, it is not due. The really only ones that you're going to be trying to catch up then are those clients that potentially started in September, in which case go ahead and get a support A record in them, because we want you to have credit for the fact that that client started, and you can't get credit for them unless you have either a NOMS admin record or a support AC admin record. NOMS should now all be closed. So it should be that you can't enter in a NOMS admin record for a September 2025. So now you can go in and create that admin form in support A.
Okay, thank you. I'm
Excuse
seeing,
me. Could I
yeah,
just jump in and ask a follow-up question? Just
sure, go ahead.
regarding the example Kate just gave about folks who would have their annual falling in September of 2025. We currently have, roughly 100 people in that category, and they are showing in SPARS as being due for support A. So, and I know I've reported that before. Should we, my concern with having folks, and the same thing with some folks who are at their reassessment that fell in that same category. So they're kind of stuck at that period as if this is due, and according to what you just said, it's not due. What do you recommend that we do? Is their record going to be stuck at that period? Will it roll forward and appear as if they missed it? Or, how is that going to work out?
We're working on that with the contractor, with SPARS,
Okay.
and removing those highlights. So we ask you for right now to ignore them. It shouldn't stop you from entering a next record, because you could have always skipped them, but it is not a requirement. We have communicated this to SPARS. We appreciate you indicated that you had already flagged it to the help desk. You can, if anybody else is experiencing this, feel free to send that to the help desk and let them know, so that we can get this resolved. It wasn't the top thing to fix, because we knew we were communicating to everyone, don't worry about it, you can ignore it for now. So it may be after we get the batch uploads done, before you see those removed. And part of the reason that it wasn't the top priority is because we do need for everybody to be able to start reporting and to make sure they're seeing those clients before we can remove those things that are getting pushed and kind of telling you to follow up on ones that you don't need to follow up on, because we want to make sure that everybody has moved over, does see the notifications for the ones they do need to follow up on, and then we can remove these kind of extra ones that that you're not required to do. So apologies for that. We are working on it, but your thing of communicating it to us, communicating it to SPARS is spot on, and feel free to keep that communication open about things that you're seeing that, I heard, I read that the guidance is this. Why is SPARS doing this other thing? It's only through that kind of communication that you've done that we're able to identify and prioritize these, resolving these issues.
Okay, Art, could you clarify what you mean by you can still go ahead and enter data? So we have, and this is just one example, a case of somebody who's showing due for a 6-month reassessment, and it's been sitting there, for a few months, and the window for their 12-month reassessment is going to open in the next couple of days. So what is it we can do in a situation like that? Are you saying just go in and put in an annual when it's asking for a 6-month?
No, I'm saying put in the annual when the annual comes due. And if SPARS won't allow you to put in the annual when the annual is due, please contact SPARS.
Okay, so will that 6-month record then roll forward to the 12 months and it will just go away? We won't see that anymore?
This 6-month record is a different record from the 12-month. So it won't roll forward in that sense. But it should be archived. They should archive that because it wasn't a requirement for you to do. You didn't do it because it wasn't required. So it should remove at some point.
Okay, so when their 12-month window opens, what we should see is their most recent status is you're due for a 12-month.
Correct.
Okay.
Okay, we have time for just a couple more questions. Going along with that, Kate, when should grantees be able to expect that they'll be able to look at different dashboards again on SPARS?
So the dashboards and reporting, we're expecting in early spring. SPARS is trying to move from the reporting kind of the reporting that they have had, which has been really focused on you could download a PDF or you could download an Excel, but it was a very formatted report. They are trying to change that into a little bit more interactive and using Tableau as its backbone. But that kind of functionality, it's planned for spring. Before that, you right now should be able to see clients and enter clients there. You'll be able to batch upload and you'll be able to download records and kind of see in a bulk that you actually did have all of that information in there upload by the end of January and download by the end of February.
Okay, thank you. And one last question is about when there's a specific question about the hospitals and hospitalizations in ERs. In reference to that, if there's information that's not necessarily from specific referral documents, but instead in notes, is that information, is that any information, any way that the grantee have that access to that information, or is it has to be through an official document?
It could be from the staff notes. So for example, the provider asked and recorded, that they were talking to the client, and the client said that they were in the emergency room, provided that you have sufficient information. So if the staff notes just said went to an ER, but they don't say that they went to an ER in May, or they went to the ER in May for a behavioral health reason. So it does depend on how much information you can pull out of those staff notes, but that kind of provider conversation or other forms that you may have, we are trying to be more expansive of it, and allow you to record as much as you're able to collect out of those notes.
Okay, and then just very quickly, we have one last question about when assessments occur. So so could you just go over again when the support A and the support C is conducted? So basically support A should be done 30 days of the enrollment of the client into the CCBHC program, regardless of when they started services at the actual agency, correct?
Right. So if they weren't receiving CCBHC services under the grant, so for example, the grant started September 30th, 2024, but they had been a client already for 5 years at that point. Just like we did under NOMS, when they started services once you had the CCBHC grant, that's when they were considered a new client for the grant. And so those kind of timelines of who's considered a new client when that episode of care closes, these are the same things that we had under NOMS.
Okay.
That
And
is
so that would,
unchanged.
okay, and then so that would mean if they were already enrolled into the CCBHC program, and they were nommed before, they don't need to conduct a new support A baseline even, they just continue and they would just collect a support A reassessment annual or 6 months, et cetera, like we mentioned before, correct?
That's correct.
Okay. I think that wraps up our webinar for the day. As I mentioned, we are going to upload these and upload the webinar and this slide deck. We will be sending it out to everyone, so everyone should have access to all of this. Please bear with us, give us a little time. We have to go through a couple of processes here through our communications team to be able to send that out, but we will be sending these out along with any other information that pertains to the CCBHC support. If you do have questions, please remember you can always reach out to either your GPO or to Kate. We will be providing the email link for the CCBHC mailbox with this information. But remember, you can always reach out to your GPO. That is what we're here for. We're here to help you obtain all this information. With that, thank you very much. I appreciate everybody that joined this. Thank you very much, Kate, and the rest of the SAMHSA team that's helped support this webinar. And everyone have a great rest of your day, and we will see you hopefully during another grantee meeting. Thank you very much, everybody.